Hello and welcome to the Curated Beauty Podcast. I'm Jessica Christie, CEO of Beauty Culture Med Spa and the founder of the new functional and regenerative business, Cultured Wellness. From my start as a physician assistant to now not only being a practitioner but leading my own businesses, I've been on a unique journey through health, beauty, and entrepreneurship. Join us as we explore everything from skincare secrets to leadership lessons. Whether you're passionate about beauty or striving to balance life's challenges, this is your space to connect, learn, and shine. Let's dive in. Welcome to the Curated Beauty Podcast, where today we are going to talk about testosterone. And we're going to talk about it from the lens of treating women. I think traditionally we think about testosterone as being something that we use in male hormone replacement therapy. And we can talk about testosterone replacement in males on a different podcast, but this podcast episode is really going to focus on how important it is for the female as well. A lot of times with our evidence-based functional medicine practice and treating female patients through perimenopause and menopause, we can get them really nicely optimized and feeling amazing. But if you leave out addressing low T, something that surely will suffer is libido and really bringing home some of the intimacy aspects. So why not bring it to the forefront of a comprehensive bioidentical hormone replacement therapy and address it right out of the gate with females as well? I mean, that's what we do with our wellness practice called Cultured Wellness. As a facet of beauty culture, our providers really harness the power of testosterone. Bioidentical hormones are what we use, so bioidentical hormone testosterone. But I really want you to take away from this podcast that you may want to ask your healthcare practitioner about testosterone. And if they will not do some of the things that we talk about in this podcast, then you may need to find a different one. Okay, so I think that people know testosterone is beneficial for women. I don't think that that's a secret, or at least that it's commonplace practice for bioidentical hormone replacement therapy practitioners to use it as part of supplementation. But did you also know that testosterone is produced in the ovary right along with estrogen and progesterone? I think that's an important takeaway because when we talk about replacing what we're missing due to the aging process, are we really appreciating the fact that testosterone was there in the beginning? And when we hear some of the practitioners and some of the even leading hormone replacement therapy doctors out there on Instagram, all over Instagram, writing books, they talk about, oh my gosh, it's crazy to have a level of 70 to 100 of testosterone in a female. What are you doing transitioning to a man? There's no reason for you to have levels this high. Well, actually, I disagree. And so does the research. And that's where I get my opinions is the current research and evidence-based practice. When you look at a female in her 20s, at the prime of her sexual wellness and being, you may have a testosterone level that may creep all the way up to 300. We're not talking about measuring someone's levels at the age that they're at and then comparing it to what's normal for a 55-year-old, for example. We're talking about what is an optimal level and what are we trying to achieve and how are we trying to get this person to feel. So I really want to hone in on normal is not optimal and that there's a lot of people who don't know what they're talking about out there in the market. And so I want to shed some light on that and just bring up some points, clinically thinking and really addressing testosterone. So I think that to start, obviously, we'll talk about the fact that it's definitely a significantly less degree in females than men. There's about 10% of testosterone in females as compared to what's found in men, but it does really effectively enhance sex drive, enhance mood. It maintains our bone mass and our lean muscle mass, preventing sarcopenia, which is a huge problem as we age. It's just as essential as replacing estrogen and progesterone, but it gets left off the roster, left and right in everyone's routine, or it's like, maybe we'll add it. We'll see how you do with this stuff. So why aren't we prescribing it? it seems to be that there's a fear in society about women being on testosterone and that there's some sort of like masculine transformation that could happen. Like hair is going to grow on your face. You're going to all of a sudden get a beard, that your voice is going to deepen, that your personality is going to be more masculine. And honestly, this is all nonsense. And it's just the opinion of the uneducated and inexperienced, because honestly, testosterone, I can speak from personal experience. It's really, truly been life-changing. Progesterone gets a really good rap for being the feel-good hormone, which is so true. If you're not familiar, progesterone is like incredibly mood stabilizing. It helps you sleep. It's just the happy hormone. And it's really effective. But there's also a great, true feel-good kid on the block called testosterone. And we really only see adverse side effects of testosterone when it's way too high of a dosage and it's not being monitored and people don't know what they're doing when they're prescribing these things or what they're prescribing and in what mode and all of that. And while we won't get into all the modalities of testosterone here, I do have an online training that I'm building for us to not only onboard more healthcare practitioners in the functional medicine space and the bioidentical hormone space, but also something that other practitioners can purchase because there's just not this education out there. So at Cultured Wellness, how we do it is we use blood work. This is always in conjunction with a women's symptoms to tailor their hormone therapy. So our BHRT program is set up as an initial visit, a very large intake on symptoms, onset of symptoms, and medications that potentially patients could be on. Even other hormonal kind of contraceptives. Do you have an IUD? Like, do we need to get this out? Talk about other sorts of contraceptive methods. And we really want to look at their lab work. And we not only do this in an initial form, but also we do this in a form of really following up at 6 weeks and check in on how the patient is feeling and do we need to make any sort of adjustments or additions. Okay, so there are studies that convey concerns about women taking testosterone and the ill effects if the dosage is too high. And unfortunately, these studies did get a lot of press, while other studies, even old ones dating back to the 1950s, they recognize that testosterone has enhanced vitality, energy, sexuality, and these were all kind of tucked away and forgotten about. And I don't know if that was when the Women's Health Initiative happened and people were thinking, and by the way, all of that has been debunked. The study of the Women's Health Initiative was to potentially, what it was a study of females on hormone replacement therapy. And it was stopped because they thought that it was associated with an increased risk of breast cancer. That's been completely debunked. That's in other podcast episodes of mine, kind of picking that apart. But not only was it debunked, it was shown that bioidentical hormone therapy over time, other studies have shown that bioidentical hormone therapy has a protective effect against cancers, against heart disease, against Alzheimer's dementia, and against osteoporosis. And so when we look at all-cause mortality of the female, if you are not replacing hormones and you're just riding this natural progression of aging, really you are not doing yourself a good solid because you're really going to be in trouble later. And also the studies showed that the sooner that you start during perimenopause and then transitioning into menopause, the sooner that you initiate this hormone replacement therapy, the better off you are. So yeah, we really want to make sure that we're making adjustments on how our patients are feeling after that 6-week check-in. And then we follow them a little bit more loosely from there, but still they're checking in with us at least every 6 months, unless something changes or they need more testing or whatever. Okay, so these studies have really taken a shift to show some stuff that people are not aware of. Most recent studies, like the one in the Journal of American Medical Association, the New England Journal of Medicine, have all demonstrated that there are no side effects from testosterone in these really large studies when they're used in the adequate ranges. And the crazy, scary thing is, it's not just laymen questioning whether or not this is a good idea. There are people, like I said, that I follow on Instagram that are dominating the female menopause hormone therapy space, talking about testosterone in a way that it should be majorly cautioned, or like, why are we putting people on levels that we are? And they are literally perpetuating the myth and doing such a disservice to women from their platform. So it's really very few women who are getting the support and testosterone optimization that they should be. I recently had a call with my website team, and we were talking about some ways that I wished things could be better in terms of some recent projects that we were working on. The assets, the visuals, some features I just thought really were like lackluster, didn't match my brand, and all potentially fluff in their eyes. But to me, I wanted my e-commerce site, for example, to be like a shopping experience. And it's not yet because we're still working on it. But in one of the discussions where I was trying to voice my concerns, was the main guy, who's amazing, said, I hear you. My job is to lead a team that increases traffic to your website, increases leads calling your office, to make more appointments, that makes your business more money. And I can do that by all the things like the jargon to increase website authority and domain, which I don't care about because that's not my wheelhouse. I just care that the who that I chose to do it is doing it, and I don't have to because I don't pretend to know the first thing about websites. So it's basically like, he told me, you came to me and you said you want to lose weight. I said, I want more leads. I want more traffic to my website. And then I put you on a weight loss plan. I'm delivering these deliverables and these assets, but you don't like the way the food tastes, i.e., I don't like the way that it looks and it's not brand aligned. And he's like, I put you on a plan that works 100% of the time, but if you don't like the way the food tastes, I can understand where we're like butting up against something. And I was like, yeah, all of that stuff matters to me. I need the food to taste good to be able to stick with you. And I need those assets to be brand aligned to be able to move forward because that's a core value of mine, or aligned with one of them, I should say. And so anyway, I think that it's really important to understand, like, meaning you can't just give me the ugly assets knowing what they do behind the scenes. I need the whole picture. Your expertise and mine need to match my brand, you know? So I think that we see it as a reminder of how women in the hormone space are just not getting the whole picture, and how they are essentially being given the experience with testosterone left out of the equation. And it's kind of like serving a main course, bringing it back to food. I don't know why I talk about food so much. Clearly, I'm hungry. But it's basically like serving the main course without all the spices that make it taste good. And women do suffer from menopause, and estrogen and progesterone will treat that, but they also suffer from andropause, just like a man. And I remember working for a dermatologist, and he had like this bathroom in the back by his office where there was a book on his little table, and it said, it was from a local doctor around here that owns a big medical spa and incorporated wellness and hormones. And he wrote a book called Strong Enough for a Man, Made for a Woman, like the Secret commercial. And I was like, okay, I've never heard of women taking testosterone before. He was way ahead of his time. But also look at Suzanne Summers' book, The Sexy Years. Okay, so this came out from sources like that. Women were literally going to their doctors and asking them for testosterone. And how sad is it that it's not first coming from your doctor when you're depressed and complaining that you don't feel like yourself, or that you've lost your zest, or that you've lost interest in previously enjoyed activities, that you don't have libido, that you're gaining weight, that you've lost muscle, your body composition's changing. Why is it that our family practice doctors, our internal medicine doctors, or even our GYNs hand us a script for an antidepressant and hand us a food pyramid handout and say, here, you're gaining weight, eat 1,200 calories or less a day, then you'll lose weight. Not to mention that if a man were to go to a doctor complaining about erectile dysfunction or libido, they would jump all over it and find a solution. Women are not offered the same thing, and so that's what we're here to do. It's literally not discussed, and if it's in some way, say there's even a survey in an office, like, how's your libido? Even if woman checked bad or like not satisfactory, there aren't any solutions really put into place to really address these things from a true biologic standpoint. Sexual dysfunction, especially sudden, is not a mental problem. Just know that. So the purpose of this podcast is to really spread information to the masses of women. Like, you should know your options and have informed consent on how all of these hormones can massively affect your life. I just want to bring to light that study showing side effects are old and are usually from synthetic forms of testosterone. Bioidentical hormones, especially testosterone, well, all of them, is the best version, and users will rarely report side effects except for good ones. So let's talk about how all this goes down. So testosterone falls and over time, very strategically and methodically, and it starts in your 20s. So you have peak levels of testosterone in your 20s. And once a woman hits menopause, like, we're at an all-time low. So it's all made worse because estrogen and progesterone are low too. So that's why a lot of times we see women start on menopause hormone therapy and they feel so much better by taking the estrogen and progesterone. Sometimes even like perimenopausal women just need progesterone. And they are just so thankful that they feel so much better. They're used to feeling like crap, and they actually have no idea that it can even get better from that, but they're so thankful for what they can get. They're like, I'm not going to ask any questions. And they actually still won't talk about their libido sometimes unless they're really asked and probed to talk about it. And you can remedy that by adding testosterone. It is not uncommon for women to say to us when we ask them about libido or sexual desire that, like, I just never want to have sex again, or that part of my life is over. And after a couple months of testosterone, it is crazy what they come back to us saying at follow-up appointments about their renewed sexual desire. And I mean, you can use your imagination to think of all the things that may have dwindled off, like fantasies, spontaneity, being like, it's not all about sex, but like when you tell a woman that you can restore like multiple orgasms or like the number of times that you have sex, that's huge. And I actually also think that women sitting in that position, like, that just sounds like too much to even think about. And so we can even table, like, you don't have to take that for face value of the only benefit that you're really going to see from testosterone. I think that we should talk about more benefits of it too, because you may be so far removed from thinking that's like something you want that it wouldn't move the needle for you to ask for testosterone to be added to your estrogen and your progesterone regimen. And if you're not even on those, please, please, please come get your labs done. Just call us. So what else can testosterone do? My goodness, can it improve the attitude and the ability of you to look at your life differently. So just really, really amazing. We're going to talk about that more. But first, I want to talk about how estrogen for a second and how it can affect something called sex hormone binding globulin. So SHBG for short. So sex hormone binding globulin is a protein that can keep testosterone bound up. So when we do a test for testosterone, we will measure 3 different things: testosterone, free testosterone, which is the free available testosterone that your body can actually use, which is significantly lower than your total testosterone, and your sex hormone binding globulin, because it's an important feature of what's going on with the total and how much is in the free version, etc. Okay, so just so you know, estrogen can increase your sex hormone binding globulin, meaning that it will create some testosterone that's more bound up. So if you're on estrogen therapy, it really argues that you actually need even more to increase a little bit of that testosterone from a bioidentical standpoint in a supplementation fashion, because that is really, really more available than some of the bound up version that could be happening from the sex hormone binding globulin going up and your native testosterone being even in a worse dwindled position. Obviously, we're not going to stop estrogen because estrogen has massive benefits on cardiovascular health, bones, brain, the vagina. So we just supplement for the testosterone so that we can remain more optimized in general. Okay, so if your doctor won't measure you, like if you ask for testosterone and they just grab a testosterone and they tell you it's in the normal range because they're just looking at the range, they have no idea what number to look for the most part. If they won't measure your total, your free, and your sex hormone binding globulin, you need to find someone who will. Okay, more benefits. Let's talk about your bones. Our bones become weaker as we age because of declining hormones. And how many of you have seen that woman like pushing their cart in the grocery store and she's just all hunched over and shuffling? I mean, aging can completely warp the body. This is from interruption of what bones do best when we are young. There's a balance of something called osteoblasts that are building bone and osteoclasts that are breaking it down. They're in a perfect equilibrium, but when our hormones decline, that equilibrium is disrupted and we start breaking down bones faster than we're laying down new bone. And the plot twist comes in when we replace hormones and your bone all of a sudden becomes more dense. Go figure. So shifting where osteoblasts is greater than osteoclastic activity. And research shows that when testosterone is added into the routine, it has even more of an effect than just estrogen alone. So estrogen and progesterone alone. So it's not in negligible amounts either. These studies are showing that bone density is increased by 50% in patients on testosterone and estrogen therapy versus just like an estrogen progesterone therapy alone. So this should make you find a provider that knows proper testosterone therapy and will prescribe it to you. Gentle reminder, we aren't giving the body something new. This is a hormone that was present in large amounts, larger than a lot of hormone replacement doctors will prescribe back in your 20s. That's what it's about, replacing to optimal levels, not normal for your age. Normal is not optimal. I'll keep saying it, I swear. Okay, so let's talk about the side effects that you could see. Well, for one, your collagen and elastin content in your skin increases. So much of what we do in aesthetics is really nicely mutually beneficial with bioidentical hormone replacement therapy. That's why it's one of our most popular procedures, right along with comprehensive medical weight loss, because those two things play so nicely into what we do with aesthetics and how people feel and the confidence, because really our business, our, mission is that we sell confidence to people. And so that's really such a huge key. We can make them look good, but we want to make them feel good too. It trickles down into everything. It's also why I'm building a educational platform for wellness to our training that we already have, because I want to teach other providers how to do this confidently. It's not very difficult. It does take a lot of effort because you have to learn all of these things and read all of these studies and comb through all of the crap so that you can really understand what's happening. But honestly, this is so key to aesthetics. So it's amazing to be able to have hopefully this training program soon so that people can implement at least bioidentical hormones into their routines. Okay, another side effect is that you may notice a more youthful shape of your body. Testosterone adds muscle back on to support curves that you had when you were younger. And your fat to muscle ratio flips. You will be more toned, more defined. You'll have more energy, more endurance, more strength. You won't fatigue as easily with your workouts. Your joints won't ache as much. It's great on ligaments and cartilage. And back to your menopause our symptoms, a lot of times when women are hot flashing, we'll give you progesterone. But testosterone is amazing treatment for hot flashes, but also amazing treatment for lethargy, depression, peeing at night, incontinence, fibrocystic breast disease, headaches. So dosages that are irresponsibly high, the biggest side effect we're going to see is like hair growth abnormally, acne, and in some cases, clitomegaly, which is where your clitoris enlarges. And that is reversible. If you were on too high of a dose and that's happening, you taper down the dose and you talk to your provider about that, and it goes right back to normal. So if that does happen, you will have more sensitivity in that area. But if it's enlarging and also, by the way, there's a massive atrophy that happens to the clitoris when you are hormone deficient. So sometimes it's just coming back to baseline. But if it is getting too large, we can address it. But again, very reversible. You can shrivel back up to what you were if you really want to. Okay, so from a laboratory standpoint, trickling into all-cause mortality, testosterone added into estrogen replacement has shown to improve good cholesterol, to lower triglycerides. So yeah, testosterone as the male hormone, that's such a misnomer. It's just as much of a female hormone. And if anyone tells you differently, they need to go study human biology from the beginning of what women had in the first place and study recent articles. And you'll learn that not only do you need testosterone for optimized health in that whole picture, it's vital to longevity, living well, we need to think in terms of complexities and appreciating that the body is complex. You don't have to be a dried up middle-aged woman. You can really embrace living longer and stronger and really entering those years with a lot of confidence. I always say to my friends, I look forward to being in my 50s because you just don't care about what anyone has to say, and you've just really become this confident individual in who you are, what you know. And I think that those years are really so amazing, but you don't have to necessarily trade the youthful aspects. And if you're really trying to participate in anti-aging, it is only natural to extend that into the bioidentical hormone realm. And you don't need to wait until you're in menopause to benefit from some of this hormone replacement. I hopefully am pretty far away from menopause, but because of stress, because of potential viral illnesses, because of just childbirth and all the things, my hormones were not optimized, and now they are. With a little progesterone, I take a little testosterone, very, very small doses because you don't need a lot. But the way, and I take other things as well, supplement wise, but the way that that has optimized my health, given me the restored interest in things I previously loved, the energy, the vitality, the zest, like wanting to get out of bed, those things come from replacing what's lost through the aging process. And if you are in that place where you're questioning, like, man, some of the things she said resonated, I really, really recommend you take our virtual wellness tool and get in contact with one of us. We will reach out to you if you take the tool, and it's up to you whether or not you want to take the next steps, but it's free. It's very easy to do. It's fun. It's very short. It takes like a minute. And also, if you're interested in becoming a patient of ours, you can find us all linked in the show notes. So I hope this episode was enriching. I hope it taught you something that you didn't know. I hope that it helped you in terms of your own health journey. And I look forward to continuing these talks on not only hormones, but all of the things to help you live your best life. Thank you for joining us on another episode of the Curated Beauty Podcast. If today's discussion sparked your curiosity, or if you're ready to take the next steps in your wellness journey, we invite you to explore our new virtual wellness tool. It's an easy and convenient way to assess your needs and connect with our expert team for personalized guidance. Visit our website, beautyculturespa.com, to get started, because your health and beauty deserve nothing but the best. Until next time, stay radiant and take care.